I'm Lisa Geroux. Wase Manadokwe is my spirit name, Shining Spirit Woman. I'm the Executive Director of the Shawanaga First Nations Healing Center for the last 7 years. Some of the hurdles with the NIHB funding is the coverage. A lot of people don't know about the coverage for prescriptions. It's not always covered, and then we get the shock. Our people get a shock. Our seniors get a shock that's not covered. You have to understand what's covered and what's not. Some people don't even know that it's covered, and then we educate our community members that it is covered, both on and off reserve, to make sure that they get those services that they deserve and that they need. So, and equipment, equipment that's covered. Some is, some isn't. So that's some of the part. They want a certain doctor, but that doctor's not covered. And then to go and tell them that we can't cover it, or FNIB won't cover it. We've went that extra mile and phoned FNIB, emailed FNIB. Just recently had a talk with the top person at FNIB to say, I need this doctor for this person. The mental health is not very good there in that family, so we would like to reach out to this. They would prefer this doctor, and they still said no. We've had a few members that have attended the list, as stated previously, and did not like that doctor. Very rude, insensitive, get over it. You're not helping yourself, you're wallowing in your own sorrows. Grief is huge in our community. You can't tell a person that. You have to be sensitive. You have to know the past history of that First Nations if you're going to work in that First Nations, or you're going to see our people. And that's throughout Turtle Island. You have to know the First Nations. So those doctors that FNIB has should know exactly what happened in our communities, and they don't. And that's the jam, is where they won't go back. But they go in there with damage, they come out more damaged. And then we have to try and help them and fix it. The mental health is huge right now. It's over the top. In the corridor that I work and live, we need to revamp the mental health system. We need to revamp FNIB for sure. I don't think it's for the people. It's for the government. It's not for the people. And that's our treaty right, to have this and to make sure that our people are covered in a good way.